Hello, hello, hello. This is Tooth Be Told, Dr. Kyo Dumpert,
Dr. Walter Aka.
and we are with Dr. Chris Godla. Welcome.
Thank you. I want to do this again. Dr. Chris, can you just show us your actual background? Because you see Kyle's and I's background, and then you see his. And that's actually not even digitally enhanced. That's literally his background. So I hate him for this right now. So what I say is just pure. It's just purely just jealousy. So I'm gonna put it out there right
now. so Dr. Chris Godla. I went to dental school with Chris. That's where I met him, and he's currently a new practice owner on Kauai in Hawaii. And I thought it would be a good time to bring him onto the show to talk about his experience on how he got to where he is and what he's experienced the past year with the pandemic and living on an island that's been shut off to the world, basically, and buying a practice and everything else. So, again, welcome, Chris, and give us a little bit of your history and how you got to where you are.
So Kyle and I graduated from Pitt in 2013, and I did an AEGD over on the Big Island of Hawaii in a city called Hilo. And after that,
so how'd you get there? What made you go to Hilo, Hawaii?
Right, there's you have 49, actually 48 states you could pick from. And you said, I'm going to go ahead and avoid all that and just go to an island. How did you get to that point?
I basically just looked at, sunny, warm, tropical places where I could surf. I think my parents, my family were like, oh yeah, he'll do that for a year. He'll come back, I'm from Pittsburgh. So I flew to Maui. I flew to Oahu, other Hawaiian islands. I flew to the Big Island, and I met with the current residents, and ultimately the only island where anybody surfed was the Big Island. And I lived with one of the residents who was doing a second year. He's actually a periodontist practicing on the Big Island now. His name's Jeremy Oakley. So we roomed together when we were both residents and just surfed and practiced dentistry.
Can I just say that I'm starting to get a trend here? It seems like everybody that does very well and kind of knows what they're doing are the people that end up doing at least 1 year residency.
Yeah,
right.
Absolutely.
Because that allows you to explore the world and kind of get to know what you want to do. And that's another reason why I honestly think a year residency is something that should be needed.
Well, let's be honest. I can speak for myself that I wasn't comfortable seeing patients on my own coming out of Pitt. I needed that 1 year of extra treatment or extra education to feel comfortable. I don't know. I mean, we all went to Pitt, so we all had the same education, right?
Right. And then, I'm not saying that Pitt is doesn't prepare you to do it, because I knew people from my class who graduated and went straight to work, right? Mm-hmm. But what I'm saying is the fact that, Chris here decided to go and explore somewhere totally different from Pittsburgh, mm-hmm. right? And then found basically an area that maybe he would have never known if he would have went or stayed in Pittsburgh and worked. Right. You see, and that's I think that's what's so cool about at least doing a year of residency. You get to go somewhere different.
Yep.
Yeah, I think it's a great idea. Does California mandate it in place of licensure?
You can do Cali and New York. You can do that. Yeah.
Yeah, it's not a bad idea.
Right.
So you finished your residency on Hilo, and then where'd you go from there?
And then I was like, okay, I need a real job. I think I made $40,000 in that year, so I could barely afford food. I got to get something paying a little bit more. So there's basically one big dental chain in Hawaii. It's called Hawaii Family Dental. Okay. So I called them up because I don't have any. Well, I had very few contacts in the dental world. Maybe just a couple on Hawaii Island, and so I called up the CEO, and he's like, sure, let's go out and have a coffee. And he's like, I can use you in two places. I can use you in Kona, which is on the western side of Hawaii Island, or you can go out to Kauai. And I was like, oh, I've already been to Kona. I know what it's like. Let's go to Kauai. So I've been over here ever since, and it's been 7 years. So I worked in corporate dentistry for it was almost 6 years, which that has a whole series of ups and downs, and I learned quite a bit, but I came to a point where I was like, this is just not going to work anymore, and I wanted to be my own boss, and I was like, so through the local Hawaii Dental Association and the Kauai County Dental Society, I met, most of the dentists on the island, and a lot of the older dentists basically wanted to retire after COVID or during COVID. So I reached out to a couple of them, and, one dentist in particular, his name was John Black. He'd been on the island for over 50 years. I think he was practicing for just about 50 years. And he was like, yeah, I'm done. So I worked out an agreement with him and took his practice over. And it's been about 6 months now, and we're doing really well. We're busy. Patients seem receptive, and it seems to be okay.
Can I ask, when it comes to your mind shift change, you went from corporate and you worked for them for how long?
Almost 6 years.
6 years. What mindset, what changed mindset wise that said, you know what, I'm ready, right? What changed in the 6 years that said, you know what, I'm ready to do this? Was it finances? Like, hey, I'm done my student loans. Was it just being tired of having to deal with or answer to other people? Like, what changed?
I think a lot of it had to do with the finances. I think, the particular company I was working for basically took all the dentists off of a production-based model and put everyone on a collections-based model, and cut us, I don't know, 10 or 15% in terms of what we were making. And I looked at the numbers and I was like, look, I'm better off risking, something on my own rather than working for, the percentages they were willing to give me. And, I'd saved up. I have a nice house, but I live fairly frugally. And I was like, if I'm going to take a risk, now's the time. I'm young, I'm healthy, and let's go for it. So I think it was basically just a combination of COVID and the, financial pressures that the company was facing. And I was just like, I got to get out of here.
And I think the way you did it is with the dental school year coming to a close here soon, and a bunch of graduates coming out. Everybody's going to be either looking for jobs, or there's going to be a flood of dentists hitting the market here pretty soon. And I think the way you went about trying to find an office, you weren't contacting a broker and having a broker find different opportunities for you. You really hit the ground, did the work yourself. You sent letters, you met with all the dentists on the island. And granted, Kauai is not a big place, and so it's a very small community. We knew each other there. Everybody there as far as the dental community. So it's a little bit easier, I think, to reach out, but it's you kind of created your own opportunity there by going out and seeking those that opportunity versus relying on somebody else or waiting for somebody to post their practice up for sale.
Yeah, I think the transition itself couldn't have gone much better. We basically did it on a handshake. The dentist, Dr. Black, he goes, I've never used an attorney in my life up until now. So I mean, I was kind of shocked when he said that, but I mean, I don't use attorneys or anything. So I mean, it was, he's basically around the practice. He'll just randomly pop in. The patients love him, and so yeah, I looked at a number of practices before, some through brokers, some through just word of mouth, and I basically waited years for just the right one, and I think this is, so far it's been the right choice. But
so while the rest of the world is suffering from COVID, you're saying there was a silver lining for you, because I get the sense that helped you kind of push you into making that switch. Did that have anything to do with it?
Yeah, absolutely. I think that COVID, basically I had a few months off, and it just gave me some perspective to just, kind of take a step back and say, look, I'm ready to make this move, and, just gave me some time to really plan it out.
Well, and I think we should talk about the whole collecting versus production method of getting paid, right? And correct me if I'm wrong, but production is what you do, what you get paid for doing. So it's what you do, you get paid for doing it. Collection, you're kind of at the mercy of the office being able to collect the money.
Absolutely.
And you said you lost percentage-wise. What was it again?
I think they cut our percent down like 10%. So if I was doing like 35% of production, I think it was like 25% of collections, which, I don't necessarily.
That's huge. That's a big number.
Yeah.
Yeah.
See, that's something that a lot of students, like you said, Kyle, coming out, they're going to have to face that and understand what that means. Sometimes an office will tell you, oh, it's 25% of collection or 30% of collection. Oh, but don't worry about it, by the way. We're close to 100% when it comes to collection. That's BS.
Right.
I have yet to meet a single office that is 100% collection. Yeah. I have yet to meet that office, You'll see. They'll be like, oh, well, we're just going to write this off. If you write it off, it doesn't mean, sure, you didn't collect it and maybe might not hit your collection, but that doesn't mean you're 100%. You just ignored that money.
And you as the doctor are not in charge of that write-off. It's somebody else that's in charge of that write-off. So you never see that money, and there's nothing you can do about it.
It's kind of a scary predicament to be in, because you're basically at the mercy of a company or a front desk person, somebody making these calls to try to make the collections, and you don't know what's going to happen. So I would suspect that their collections were somewhere in the 80 percentile. They certainly were not 100%.
Not even close. Can you talk about, so you found a practice, and now, Dr. Black, you guys are good. You're setting up, like, how did that whole go? That transition of how do you get the office in your name? Do you have to change the name? What did you see when it came to patients and retention and so forth?
I mean, so far it's been pretty good. There's definitely been some issues just in terms of, I think at a certain point, a lot of the dentists will see the patients almost as their friends. Okay. And that's definitely what I saw in this particular practice. And I think because of that, he gave a lot of discounts, and I don't know if, maybe financially he was set and didn't have to make a lot on the practice. Like, it didn't have to be very profitable, but, when I took it over, I basically just made sure that we were collecting what we should. And the office itself, I think, hadn't really been updated in probably 30 or 40 years. So, I recently changed up the hygiene room chair. I've got new sterilizers, new hand pieces, new x-ray sensors. He was basically paper charts, still kind of using some paper charts here there.
It's a long transition.
Yeah.
So the money, where did you get the money to actually make some of these upgrades? Was it at the bank, or did he kind of finance you? How did that work?
So basically I went through a local bank, and I shopped around. I checked out, Wells Fargo and US Bank, and Central Pacific Bank is actually the bank I used, which is a local lender. And, they have like a special niche branch, and the guy I used his name is Scott Kurosawa, and he just manages basically all the dental financing, and he's, they financed other practices. So I took out a few $100,000 to buy it, and then I took out some working capital and used the working capital to finance some of the improvements.
Was there any hesitation with it being in the middle of a pandemic that the banks weren't willing to lend quite as much? Did you run into that at all? Were they still saying, look, dentistry is a good profession to be in. We're not worried about it. Take whatever you need.
So, somewhere in between those two extremes. I think, it wasn't just, here's a blank check, just buy whatever you want.
Well, if that's the case, I want to open up a bank account with them.
Fortunately, the guy I used at Central Pacific, Scott, he was very familiar with the practice. He'd been in it, a number of times over the years. I think he understood the patient base, and a lot of the patients are prominent members of the community. They're doctors. They own the local car dealerships. So they're great patients, and I think that understanding in a bank that is willing to work with you is key. So I would definitely look at local lenders if you're a new grad looking to buy something, and just having that kind of local knowledge was really favorable for me. And in terms of COVID, I think that I think that the pandemic definitely influenced their financing of the project a little bit, but just because of that insider knowledge, they pushed it through. I think up to a certain loan limit, the fees to take out the loans are very, very affordable. I think I paid less than $200 in terms of origination fees for the practice loan, which is great. I think if you go above a certain threshold, it's becomes a couple thousand or whatever. So it was almost considered like a mini startup in some ways, just because there was the patients were there, but the facility was pretty run down. So just another facet of the deal.
What was the biggest challenges that you thought, looking back, from the time you decided to buy or that you wanted your own place till where you are now? What do you think some of the bigger challenges were for you?
I think just having a good staff, that was, I was really, really nervous about that, more so than probably anything else. Like, will the staff stay? Like, will that key front desk person, be there to help with the transition? Because, they know the patients inside and out, and, they know that, Mrs. Yamaguchi can only come Thursday afternoons. And so I think, I was actually able to retain the front desk. I retained the assistant. I retained one hygienist. The other hygienist was the practice owner's ex-wife, and she'd been there. Yeah, so she was there for 47 years with him. So I don't know how they made that work, but they did. And I wanted to retain her. Unfortunately, though, a few months in, she's like, I think I need to retire. She's 70 years old. And so,
oh, wow.
Yeah, I attracted another hygienist from a different office. So I think staffing is just always kind of in flux. And I know that one of our advisors, Kyle, is like always be looking for good staff. So I think what I found is my current staff is actually the greatest source of referrals, in terms of other staff out there. So I rely on them. Like, hey, like, do you know of another assistant? And that's how we got our second assistant.
So I guess I feel like you and Kyle kind of are in the same situation where, it's a small community, right? So, I mean, I'm in Houston and it's hard to find a good assistant, and you're in a smaller community. How are you guys managing to find good quality, staffing, like you said, and pay scale wise? Like, does that mean that you have to pay them more because they're so limited, or how does that whole thing, and how did you think about that when you were taking over?
Yeah, I think, in terms of pay, like, if I have a good assistant, I will definitely pay them at the higher end of the pay scale, which, I know that the corporate job I used to have, they might pay their assistant $17, $20 an hour.
Pennies on the dollar, yeah.
For a better assistant, you might pay, over 20, close to $25 an hour, which is significant. But, just in terms of making our job easier, I think it's crucial. Yeah, it's definitely a very, very small community. Basically, everybody knows everybody else, Yeah, I think just having a good reputation as a provider, as like a fair business owner, not trying to, cheat the patients, cheat the staff. If an issue arises, just address it immediately. Like, hey, because things will come up, things will happen, and it's like, hey, can you take a look at my paycheck, Dr. Godla? It looks like this is inaccurate. Just instantly look, oh, sorry, fix it. Whatever. Because I hear all sorts of stories like, oh, this other office I used to work in, they owe me $40,000. They haven't paid me. Like, I'm just gonna walk away. Like, or there's all these inaccuracies. Like, I'm just not getting paid. Blah blah blah. And it's like, just if you just do the right thing, by the patients, by the staff, I think generally, especially in a smaller community, that will get out. So,
and I think that's from my own experience was, and with Chris, by being able to go into the practice before you buy it a little bit, meet the staff, see how things are run. If it's a practice that's been there for 30, 40, 50 years, like my practice was, like Chris's was, and you had the same staff, or the previous dentist had that same staff for a long time, then they're probably, I would hope, getting treated in a good way at that point. And you can be a little bit more confident that you're also getting a good staff with the office that you're buying. And as long as, like you said, treating people the right way and really retaining that good staff, because the couple of times I've had to look for new staff members because people retired or whatever, that's a financial toll by being understaffed, by advertising to bring somebody in, and it's also an emotional toll, not only on you as the owner, trying to find that right person to fit inside that dental family, but it's also stressful on the other staff members because they're picking up the slack while that other person's missing. So I completely agree with Chris when he says, treat people right. And, I think they'll stick around with you for the long term. And that's the biggest advantage of that small community, where there isn't a lot of practices they can jump around to. And if you treat them right, word's going to get around that you're a good person to work for.
What about when you first took over, right? I'm sure that you might have lost patients. What do you think the percentage of patients that you lost because of the fact that they're like, well, you're not Dr. Black, I'm going to have to go somewhere else? Or, just, again, that, hey, he gave me a discount, you're not giving me a discount,
Sure.
So like, what do you think the percentage was, and how did you kind of go through that?
I'm trying to think about it in my head. I mean, I would say, I would like to believe that that's a small number, but it's probably not as small as I want to believe that it is. It's interesting. Now I'm thinking about, patients will actually come up and ask, like, hey, like Dr. Black used to wrote off all my copays. Are you willing to do that? And, initially I'd be like, well, just for this visit, sure. And now it's like, hey, look, I'll work with you. I'll give you like a 10%, family and friends write off, but, I can't just be, writing this off kind of thing. So I think I would like to believe it's probably 10 to 20% of patients have left or found another office closer to home, but it could be substantially more or less. I'm guessing at this point.
Well, yeah, and I think there's stats, and Kyle, correct me if I'm wrong, isn't it usually like 20 to 30% of people actually leave whenever a new provider buys the practice? Like, I felt like it was like 1/3.
I've never actually heard that stat.
Okay, yeah.
I would
for any patients that are listening, we can't write your copays off. Like that's insurance fraud. We sign a contract with the insurance company. You guys sign a contract with your insurance company. We have to follow this, or else it's insurance fraud. So you might have gotten by for 30 years by not paying something you should, but if you leave the office, whatever office you're going to go to, you're going to pay those same copays. Oh, why switch everything up? Stop being stupid. Follow the contract.
Oh, they're not being stupid. It's they're getting away with it because they're allowed to get away with it.
Right.
Like, imagine if someone said to you, oh, well, you don't have to pay me today. And then the next time you're like, oh, I don't have to pay you again, right? Like, you go to a grocery store and you don't have to pay. You're not breaking the law because someone was like, hey, I work here, it's mine. You don't have to pay. Cool. See ya. Thank you. I'm not gonna question that. 30 years, you just saved me thousands of dollars. Why would I question that? You're the best dentist I've ever had. You know, they're not being stupid. You're being stupid, but they're not.
Good point.
What I mean?
Good
Why
point.
not ask?
Yeah.
So how has it been when it comes to balancing family life now with ownership? Because now you're taking on more responsibility, and you know, and again, congratulations, you have a 13-month-old now, right?
Yes.
So how has that been with that transition, right? Because now you're not an associate in the practice where you just work and then leave. You have to deal with a lot more.
And more importantly, how has it affected your surfing?
Okay. You know, I think one of the things my wife really insisted upon, you know, and she'd been trying to get me to do it for years, is to cut out that 5th day a week. I think, you know, whether it's a Monday or Friday or whatever day a week, I think, you know, I just found that took too much of a personal toll. So I've basically been working 4 days a week. You know, I don't mind if they're longer days. But, you know, some days 10, 11, 12 hours, you know, that's not all clinical, you know, work. You know, it's a lot of, you know, paperwork, whatever, staff management issues. But I think really having that extra day is, you know, for me at least, it kind of recharges me. I want to go back into the office on Monday. I think without that, I would just slowly get burned out. You know, I think Kyle can probably attest to this, like, you know, taking a trip maybe every 6 months or every 4 months just to kind of, you know, take a couple days off is really key. I think my family, you know, it's my wife, myself, and our son. My wife works full time. She's a physician assistant, so she works in a local urgent care. And her job has kind of been a little bit all over the place just because we are so reliant upon tourists here that the local urgent care has basically, you know, is seeing maybe a third of the number of patients that they saw in the past. So they put her in pediatrics. So one of the things that we did to kind of make it easier was we got an au pair. From Brazil. So her name is Paula. And when she and I are both working, Paula takes care of Jack. So I think that's really alleviated a lot of the stress. I'm all for that. You know, it's just because, you know, childcare on the island is so expensive. You know, if we had to pay someone whatever the going rate would be, is probably like $15, $20 an hour. And you just can't find somebody with COVID. You know, we looked locally, we tried to find someone, and it was nearly impossible. So in terms of surfing, because of the au pair, I still get to surf at least a couple days a week. So I've been happy. You know, I
love the fact that is the most important thing Kyle could ask. This podcast is about management and business, and he's about the surfing. Let's talk about it real quick.
The stress of owning a dental practice. We all have to find our own releases, and surfing is. I mean, anything with the ocean in Hawaii is, you know, pretty integral to life. And Chris is one of those guys that the bigger the waves, the better. And when I lived down there with him, there were several times where I thought we were going to die going out, and Chris is, nah, man, it's going to be good. Let's go. And he's fearless when it comes to not just surfing, but, you know, other aspects of life. So surfing is a big part of his life before marriage, before having a baby, and it's good to still have those your own releases even after other things start to come into life.
Let's talk about referrals. How is that on an island? Like, do you have an oral surgeon? Because Kyle always talks about how hard it is to get into the schedule of the specialist. How is that looking for you?
Yeah, I completely agree. I mean, we have one oral surgeon.
Jeez.
We used to have a periodontist. I don't think he's practicing anymore, so we don't have a reliable periodontist we can refer to.
I might need to pick up.
Yeah, man, you want to fly out?
I might be picking up surfing.
There you go. I'll take you out anytime you want to go. There's one orthodontist. There's one endodontist.
Okay.
So what I found is I've been doing a lot more oral surgery just because I've found that the patients hate going to the oral surgeon generally. In terms of like implants, I've placed a couple in the past, but I'm not totally confident in doing it. So what I'm going to try to do is get one of my periodontist buddies to fly over, maybe a couple times a month just for perio surgeries and things like that. But yeah, I mean, I think just to get patients into a specialist, even the endodontist, I mean, they're somebody's in pain and they may or may not be able to see them within a few days. So I'll generally treat a lot of endodontic emergencies. So yeah, I think you kind of become more of a jack of all trades in a smaller community like this, which is good. But I think it's just a different practice model. If you were in a big city, you would probably refer a lot of those cases out. But I think here, the patients generally appreciate it. I think you don't want to get in too far over your head, but at a certain point, I think you'll kind of challenge yourself with some of those cases, and generally they've turned out pretty well.
And I think something a lot of the dental community is worried about is lawyers and litigation and getting sued. One of the benefits of the smaller communities is because you have that more of a friends and family relationship with people. I don't think that litigation rate is quite as high. And if you're explaining everything to the patient and they understand that, I can't just go down to the street to the oral surgeon and get in within, a week or two. As long as you're willing to, try your best and kind of warn them, like, this is something that could happen. I mean, we're not going into, cutting out oral cancer and things like that. We're do what, you're comfortable with, but I think they have they're more understanding of what the limitations are of an island or a small town or something along those lines. And they just appreciate that you're willing to, and you're knowledgeable enough to help them with most aspects of what their needs are. And if something goes wrong, like I think they're more understanding where maybe in a big city, they're looking to sue.
Yeah, they're not going to call their lawyer tomorrow and just be like, he did this to me, like, blah, blah, blah. I haven't found that here on Kauai. So,
let me ask about insurance. The office, is it a lot of insurance that he used to take or you take, or was it more fee for service? How did it all work out?
It's basically he took one major insurance. It's called Hawaii Dental Service. It's part of Delta Dental.
Okay.
So that was his main insurance. That was the only one he was par with. There's a lot of kind of older patients in the practice. So there's a lot of Humana, which he was not par with, which I'm currently credentialing with just because of the numbers. It might have been, 25 or 30% fee for service, which I was actually surprised by. I thought that it was a lot more insurance based. So we'll actually have a decent number of patients who will come in and pay cash, literal cash. I'm just like, whoa, you gotta walk across the street to the bank today, which I was shocked by that because nobody pays cash for anything. But
so what? It sounds like what kind of boards? Now I'm actually just looking to find out what kind of board I'm going to buy.
There you go.
The more I'm like, okay. So what kind of boards do I surf with, guys?
I mean, start off on a longboard. I've got plenty if you want to borrow them. And
listen, it sounds amazing, man. No, I'm serious. I'm liking the vibe of just kind of, what, everybody's there. You're looking out for each other. You're not taking a lot of insurance because insurance, man, like I feel like insurance, Kyle, we're not going to have you go on a rant, but I feel like insurance will literally take 30 to 40% of your overall production just based on insurance and how much they cut away from your UCF.
Yep.
You know what I mean? Like if there was no insurance, this is how much let's say it was like $100. With insurance, you're looking at like maybe $60 to $70, you know?
Right. Yep.
Yeah. And I mean, like that's a lot of money when you look at how much you could have possibly made on a procedure versus how much you actually make. And it's not like you're going to do less for that patient. The quality is still going to be there. You know, it's just the insurance is not paying you anything for it.
Right. Can we talk, how did COVID affect your ability to get supplies? So Hawaii is pretty far out there. So there's no real availability of overnight shipping or things that I could, in the mainland that you can get a little faster as far as lab cases, or, we all struggled with PPE and other supplies because of the whole shutdown of the supply chain. Do you feel like that hit you harder being in Hawaii and some of the travel restrictions, some of the other things? Did you have to plan out further in advance?
Yeah, I mean, that was one of the aspects that I never had to worry about, being an associate, working for somebody else, was basically ordering supplies and just making sure we have whatever on hand that we need to use. So, yeah, I mean, in terms of, gloves, masks, gowns, things like that, I initially, used some big online retailers. I have accounts with Patterson Dental, Henry Schein, Scott's Dental, what is it, Net 32?
Yeah.
Mm-hmm. Yep.
So all these big retailers. What I found is, a lot of the mainland based suppliers like Net 32 and Scott's, getting supplies from them was particularly difficult. It was kind of hit or miss. The local Shine and Patterson were actually a little bit better. Some things you can get shipped in a couple days, if they have them in stock on Oahu, which is basically the central location. But I guess what I had trouble getting was local anesthetic at times. So I would just place huge bulk orders for, I don't know, 10 cases of it, and just, so that was one thing I had trouble with. I think gloves are something I, always have an issue with. I think Shine will only let you order 6 or 7 boxes at a time. So there's no big cases that you can't order 20 boxes. So I'm just constantly scrounging for those. What I found is actually our local Costco will actually stock nitrile gloves every once in a while. So if you're not particular, that might work.
Well, it's not even. No, Costco is amazing. I buy gloves from Costco. Don't undervalue Costco.
No,
right?
No.
That's blasphemy in my eyes.
No, I completely agree with you. When I was looking for gloves, I walked into Costco the one day. It's like, they're cheaper here than I could get at Shine, and they're in stock. Like, absolutely, I'm going to buy them here.
Right. So talking to your friends that you graduated with, like, how do you see like the way they're hustling versus the way you're hustling now? Like, I can already tell that you're just a chill guy from the get-go, so maybe things don't bother you. And Kyle's crazy that way too. But when it comes to other people, you know what I mean? Now that you've transitioned to ownership, and I'm sure you know people who are still associates and stuff, like, how do you see that transition and just kind of like the conversations you have with people?
I mean, I would say that, I'm still in that kind of fight or flight mode, and I think I'm going to be in that for a while, just, looking at like spear videos and stuff. They're like, the first 2 years, you're just in this mode where it's just like, I got to do this to be able to pay the bills. I always think about what Kyle says, generally 99% of dentists are successful. It's the 1% with substance abuse problems and things like that are, going to go down. But
that's a nice quote, Kyle. That's really uplifting, Kyle. We're all friends, buddy.
But yeah, I'm still in that kind of mode where it's like, man, I gotta do the very best and, see, a lot of patients. And then, I'm starting to like loosen up just a little bit. And, I think somewhere in the back of my head, there's this kind of voice saying like, you gotta just keep pushing forward, just keep going. It's gonna be okay. But it's still scary. But yeah, I think there's a part of me that thinks like, why isn't every dentist at some point making the jump to private practice? Because I think that it's in your best interest in 90% of cases. There's definitely some providers that would benefit from corporate structure, but I think if you can get through dental school, if you have that kind of drive, I think you should be in charge of your own destiny and not another person or company. So
absolutely, that's
we're biased, I think. I mean, only the crackhead dentists don't make it, so that's how I look at it now.
Yeah, it's true. It's true, and that I feel like that feeling of failure or potential failure doesn't go away. I mean, I'm 3 years in, and I still worry about that. That is this decision I'm going to make today going to affect my business? Are patients going to continue to come in next month? And I think COVID really helped with that, because even after a pandemic shut the country down, a lot of dental practices came back stronger than ever. And it just speaks to the fact efficient. That we more efficient, we had time to focus on the business aspect of it and maybe fix some things. But dentistry is always going to be around. People are always going to have cavities. They're always going to need a tooth pulled or root canals or gum disease or any of the things that we treat. And we've put ourselves in a position in a profession that we have job security forever. There's never going to be a robot to replace us, as long as, goes back to what Chris said, as long as we're good people doing the right thing, taking care of our staff, taking care of our patients, we're not gonna, we're gonna make it.
Well, Chris, let me ask you this: when it comes to paying yourself, because you still got to live, right? Are you doing, one method, which is basically paying yourself a percentage, or are you doing the let me pay myself after I paid everybody else?
Yeah. So for the first,
or the third option would be using the bank to pay yourself.
So basically, for the first few months, the accountants were like, "You're not going to get a paycheck. Make sure you can, survive." And I was like, "Yeah, I'll be fine." After we kind of demonstrate, so everybody else got paid before I did. All the staff, the suppliers, everybody except me, which is fine. But after, I don't know, 2-3 months, we were doing okay. There was a little bit left over. I took a relatively modest paycheck, probably a third of what I was making in the corporate dental world. It's been bumped up a little bit, but my paychecks are still, significantly less than I was making. But I think on the flip side of that, whatever profits we're making are going into our, company bank account, and I basically haven't touched it. So, we can use that to set up 401ks for the employees, which is what I'm doing now. Just another way to hopefully keep them. But I'm kind of viewing it more as like a long-term decision, because I hopefully want to be doing this for a while, and I want the staff to be happy and my family to be happy here. So I don't mind taking a pay cut, as long as I can kind of see the end goal, which is saving for retirement and providing for the staff.
So Chris and I use the same accounting group, Practice CFO. They're based out of California, and I pay myself basically the same way. And the way I look at it, we look at it, is a lot of dental or dentists that don't have a dental specific CPA, they'll basically pay all the bills, anything that's left over for the month. Great. This is what I'm making, this month or this paycheck or whatever. And I've heard of several offices or dentists that are kind of living paycheck to paycheck because they're not managing their money well. If there's money in the bank account, they're spending it. Whereas if you look at it as a business owner, and you're the only dentist. You play two roles. One is that business owner, one is you as the dentist. So as the dentist, continue to pay yourself as, as if you're working as your own associate. So pick a percent, 25, 30, 35, whatever the going rate is. This is what I would make as an associate. Leave the rest in your business account. That's all the profits of the business. It's kind of a built-in savings account for you because, one, it's an emergency fund for the business. You don't have to worry about running out of money. If you need something personally, you can pull it out at that point as a distribution. But it's being frugal with your money. It's not wasting it on that doctor lifestyle or whatever you want to spend your money on. Just being smart about it. And that way, if you ever want to step back away from that dentist role and you want to become just the business owner, you have a better idea of, this is what I would be paying a dentist to come work for me, that 30, 35% or whatever. And this is potentially what I would have still in the bank account that I make as a business owner. So it's nice to have that little bit of separation in my mind of what those two roles pay or compensate me for.
All right. I guess the last question would just be, overall, do you think that, do you think you should have started earlier? And do you think that you doing it during COVID was something that is just like, you know what, I'm ready for it. No matter what, I'm not ready. Let's just get it done. And it just happened that during COVID is when you were able to do it, and meaning purchase at office.
I think I probably would have been ready a little bit earlier. I think what I wanted to avoid was a startup. I've seen other startups in the island and I think they've done well, but I personally wasn't really set to go down that road. I think I was kind of looking to acquire something. And I think because of that, it took a lot longer to find the right practice, but I think a couple years sooner, I would have been fine. I think, right out of school or right out of, residency would not have been the right move. And I think during COVID, I still had some hesitation buying the practice then. I mean, I think you always do. There's always doubts. But I think it was more just the right opportunity, maybe because of COVID, not, I'm going to do this during COVID because I have the extra time. I think it was more just it kind of fell into place then. So I think COVID kind of forced a lot of the older providers out, into retirement. Maybe not forced, but maybe they just said, look, I'm financially set, it's not worth it to have to practice with these additional regulations and, protective equipment. So
plus they're willing to give you a better deal. They might not be looking for top dollar for their practice because it is a pandemic. They're willing to take that lower price, which is better for, young dentists coming out with a bunch of debt, trying to start something up.
Yeah, absolutely.
So with being on Kauai, can you kind of explain, not from a dental view, but what life is like as a dentist pre-COVID, kind of what life was like during COVID with travel restrictions, and how you see moving forward? Because didn't Kauai recently lift some travel restrictions? What you're hoping, the next 6 months to a year looks like for you as a business owner?
Sure. I think, on April 5th, we basically, the island of Kauai reopened to tourists who, if they would have taken a negative COVID test within 72 hours, they can travel here. Prior to April 5th, we had a quarantine system in place. So if you were from the mainland or, a returning resident, you have to quarantine for 10 days. It was initially 14 days, and then they cut that down. So that was a huge deterrent. Tourism makes up maybe 70% of the economy here. So, the economy just took a huge nosedive. I personally had a baby right at the start of COVID. So that was kind of a blessing. I got to spend a few extra months with Jack, which otherwise wouldn't have happened. So that was great. But yeah, my wife and I up until a couple weeks ago, we hadn't traveled for almost 2 years, just because of the pandemic and, the pregnancy. We recently went to Wyoming for a week and did some CEs. So, hopefully, travel is going to increase. There's definitely more tourists in the island. I think the economy is going to rebound. I'm not worried about that. I think we'll be just fine. But I think that the quarantine really dramatically hurt the island in a number of different ways. So,
and again, I think that speaks to how great of a profession dentistry is, that while most other businesses are struggling, like, people were still coming in your door. Like, businesses are shutting down all over Kauai, and you're still open. You're still, doing well. You're still paying staff. You're still able to have a business, where a lot of other, especially in a tourism-based economy, a lot of other businesses aren't doing well. It's dentistry, medical. Those are things that are always going to be around. People are always going to need them.
Yeah, absolutely. Some patients did lose their insurances, but I think at this point, most of the hotels are reopening. So most patients are, reacquiring that. So that's good.
I'm jealous. I'm jealous. And by the way, if you're watching this again, that's actually a real background, not like our fake.
Yep, I appreciate you coming on to the show, talking, letting people know kind of another aspect of the world where you're practicing. So, is there anything that we didn't cover that you'd like to?
Well, and then also, how did they get a hold of you? If it maybe another Chris wants to come out there, another Kyle wants to come out there. Maybe they have a connection with somebody like yourself.
Yeah, you can contact me anytime. The practice name is Garden Island Dental. You can send me an email, gardenislanddental@gmail.com. You can also call the practice 808-245-3582. And yeah, if you have questions, I'm happy to answer them.
That just sounds so inviting. Garden Island Dental. That's just, I hate life.
You gotta come out and surf, man.
Don't worry about it. I'm coming out there, man. Like, that's a given. I'm going out there, and Kyle, you're coming out there with me, man.
If you're gonna twist my arm, I guess I'll make a trip.
Right. No, man, you're gonna teach me how to surf, so I have a reason to just come out there and live out there, man. Perfect. This is amazing. But no, thank you, guys. Thank you. This actually rejuvenated me to know that there's a better world outside of Houston. So it's good. It's awesome, man. But no, Chris, thank you again for coming on, buddy.
Thank you, Walt. Thank you, Kyle. I really appreciate it.